Hello and welcome to Ortho NorCal Educational Webinar Series. We hope everyone's staying safe and healthy and enjoying the beautiful weather. My name is Leah Arutunov. I will be the moderator for today's webinar, and I am honored to host this event together with Dr. Jeffrey Blue, sports medicine and family practice physician, and Dan Reddington, Director of Physical Therapy at Ortho NorCal. Today's webinar topic is how to fix my aching shoulder and when to get help, and it's intended for patient education only. The recording of the webinar will be available on our website starting tomorrow. And if you have any additional questions, you can always email us at info@orthonorcal.com or call the office directly at 408-412-8100. The Q&A session will be available after the presentation. You can direct your questions to us using Q&A or chat buttons on the bottom of your screen. And without any further ado, I'd like to welcome our first panelist, Dr. Jeffrey Blue.
Thanks, Leah. Hi, I'm Dr. Jeffrey Blue, and I practice family medicine and sports medicine here at Ortho NorCal. Dan Reddington, our head of PT, and I wanted to welcome you to our Lunch and Learn today. Our topic, as Leah said, is how to fix my aching shoulder and when to get help. I often say to our patients that you never really appreciate your shoulder until somebody takes it away. This talk is an overview for our patients of the many problems that can affect your shoulder and how a few simple exercise programs can help with them. We hope to make this understandable. So let's get started. The shoulder is the most mobile joint in the body. We can place our hand just about anywhere around us, over our head, across our body, out to the side, and up our back. Contrast this with the hip, which is a similar joint connecting a limb to our body. The hip is a very tight ball and socket joint that has inherent bony stability. It is very difficult to dislocate your hip. The shoulder, by contrast, floats mostly free in a very shallow socket. It relies on the soft tissue for its stability. In order to achieve amazing range of motion, our shoulder gives up stability. The shoulder does this beautiful dance between being stable and loose in order to provide us with the perfect function. Just a couple notes about the basic anatomy of the shoulder. Let's just look at it quickly. You have the bones, which are mainly the shoulder blade, scapula, clavicle or collarbone, and the humerus, which is the upper arm bone. You have the joints, the acromioclavicular joint, the small joint between the clavicle and the scapula, and you have the glenohumeral joint, which is the major joint between the upper arm and the scapula. You also have the labrum on the side here. The labrum is a rim of cartilage that deepens the normally shallow socket and gives it some inherent stability. And then the ligaments bind the upper arm to the scapula. The bursa is a pillow sac that cushions the rotator cuff muscles from the bone above it. Quickly looking at the muscles, and I know this is a lot of anatomy for everybody, but just kind of bear with me. We'll try to make it pretty simple. The scapula stabilizers are the muscles that hold the scapula and anchor it to the body. The rotator cuff muscles are small muscles from the scapula that insert into the upper arm. They anchor the upper arm into the socket and rotate it, hence its name, rotator cuff. And then you have the larger muscles, the pecs, the deltoids, and the lats that provide the heavy exertional forces. One can think of the shoulder as a dock and boat. The dock needs to be tied tight to the shoreline or it will be an unstable platform. The body is the shoreline and the scapula is this dock that needs to be anchored to the body. The boat needs to be tied tight to the dock or it will be unstable. The upper arm is the boat that needs to be stabilized to the scapula. Stability and strength of the shoulder involve both of these, a stable scapula and a stable shoulder joint. Let's now talk about you. Why would you come to see us about your shoulder? Well, your history gives away the diagnosis most of the time. Let's walk through a typical patient encounter for a shoulder problem and how we think through things. Typical complaints you may have include, my shoulder hurts. This is probably the most common complaint that we get. My shoulder is weak, or maybe there is a change in how hard you hit a volleyball or throw a ball, or how fast you can swim. My shoulder is stiff. Some of your inherent range of motion has been lost. Most commonly, it is lifting and cocking your arm back, but it can be in all directions. Some of our clues to diagnosing you include, what do? Do you throw a ball? Do you use a racket? Do you swim, lift weights, paint ceilings? Is this your dominant arm? Obviously in swimming, this is not that important, but in other activities such as throwing or racket sports, it is. Did you hurt yourself? Was there an injury? If not, did something change? Was there an increase in your training? Do you have a new racket, a new swimming stroke? What is different? What exactly do you feel? Do you have weakness, pain, or stiffness? Do you have pain at nighttime? Is your performance suffering? These can be difficult to discern. Sometimes weakness is due to pain. Sometimes you have one, but not the other. And sometimes you may have both. Stiffness can be in one direction, like we talked about, or in different directions. Finally, where exactly do you feel it? The shoulder is a sneaky joint. It would be nice if we could just point to a spot where we have pain, and that would be where our problem is, but it's not typically the case. Pain felt on the medial or inside part of the shoulder blade usually comes from your neck. The spine is the great masquerader. You can have referred pain from your neck, such as a disc or joint problem that you think is your shoulder, but actually is coming from your neck. Rotator cuff and shoulder joint pain typically are felt on the outer part of the upper arm. Your exam with us reinforces the history that you typically give us. Tenderness on the shoulder is not that helpful in the shoulder exam, as most of the problems are deeper than we can palpate or feel. Your range of motion can be helpful, and the most common problem is in abduction, or elevating the arm to the side, and cocking, or putting the arm into the throwing position. Strength is also helpful. The most common deficit is in the rotator cuff tendon called the supraspinatus. The next most common weakness is of the external rotators and cocking muscles. Finally, we may use special tests to check for impingement and stability. When we cannot figure out your problem, which is rare, with the history and exam, we turn to imaging. Imaging the shoulder is our fancy way of saying, let's order an X-ray or an MRI. X-rays are helpful in showing arthritis and calcium deposits in the rotator cuff, as well as fractures and dislocations. Otherwise, they are typically normal. An MRI is probably the single most helpful test. It shows all of the soft tissue of the shoulder, which is typically where the pathology is. Unfortunately, we cannot order an MRI in every patient that walks in, much to the dismay of our patients. An MR arthrogram, or MRIs taken after dye is injected into the shoulder capsule, are reserved for those patients with normal MRIs, but who are still suspected of having a labral tear. Let's move on to some of the most common shoulder problems. I found it is best to group these by category. First, you have the rotator cuff problems, and this is the predominance of our problems. You may have a rotator cuff problem if you have pain when reaching for things away from your body, such as a coffee mug in the cupboard or a briefcase in the back seat. Pain when you sleep on that shoulder at nighttime, or weakness with throwing or overhead activities such as weightlifting, tennis, or baseball. Strains are the most common injury to the rotator cuff and occur most commonly to the supraspinatus tendon that we spoke about before. Tendinitis can be from an acute injury such as stretching or reaching for a ball, or overthrowing a pitch. It can also be from chronic overuse. Luckily, this usually gets better quickly with home exercises or physical therapy. The key is to act quickly and resolve this in 3 weeks or less. Tendinosis or tendinopathy involves what we call, in medical terminology, a cruddy tendon. It usually results after tendinitis is ignored or not treated. Instead of inflammation, the fibers of the tendon are disordered and result in weakness and pain when used. It is important to differentiate this from tendinitis, which is a short-term problem. In general, an injury lasting more than 3 months is more likely a tendinosis and will likely take at least that long to get better, which is why it is important to act quickly when you have an injury. Bursitis is simply inflammation of the bursa, which sits on top of the rotator cuff. It gets pinched when we elevate our arm to shoulder height and above chronically. Rotator cuff tears can be partial or full. Full tears may rarely occur in young people under 50, and this is with usually high-speed trauma or in very high-level athletes. In older patients, excuse me for a second here. In older patients, this could be due to minimal trauma on a tendon that has worn down through normal life use. Calcific tendinitis are calcium deposits that form in the rotator cuff tendon. These can be acute and very painful or chronic and cause weakness and pain. Biceps tendinitis is also considered a rotator cuff problem. The biceps tendon originates from the superior labrum and is often considered the fifth rotator cuff tendon. It can be associated with labral tears. I'm going to hand this over to Dan.
So I'm going to jump in a little bit and talk about rotator cuff strengthening. We're going to have a video here in a second that's going to show one of our keystone rotator cuff strengthening exercises here. We like to use bands for some of our rotator cuff strengthening drills. In this video here, we're going to be rotating the band out to the side. The key here with this exercise, as Dr. Blue was speaking earlier, is scapular placement. We want to make sure that shoulder blade is in a tucked position that allows the rotator cuff to be in an optimal length tension relationship. Often we'll see people that are kind of rounded forward, and that's going to be putting a little bit too much strain on that rotator cuff and can give us issues with those rotator cuff injuries there. And one more time with this exercise here.
Excellent. Thank you, Dan. So we spoke about the rotator cuff. Your shoulder can also have problems with motion. Impingement syndrome occurs when you have restriction in one direction. Typically, you cannot lift your arm up to the side to 90 degrees or cock your arm back to throw or hit a ball. Frozen shoulder or adhesive capsulitis occurs when you cannot move your shoulder in multiple directions and is quite painful. It is usually self-limited, but can take many months to over a year to resolve. You can also have problems with the stability of your shoulder. Laxity or loose ligaments lead to people who tend to dislocate their shoulders. Think of the contortionist at Cirque du Soleil. The balance between stability and laxity is off. Dislocations can be a subluxation or partial dislocation, or full. These are usually traumatic, with the shoulder commonly popping out anteriorly or forwards when the arm is up and back. This is known as the most unstable position of the shoulder.
Next, we're going to run through a couple of our favorite shoulder mobility and shoulder stability exercises. The first one here is going to be working on getting the arm up overhead in what's termed shoulder flexion. It's going to be performed on our back here. Big key with this exercise, we want to keep the back flat on the ground so that we can make sure we're isolating movement through the shoulder itself and not through the spine. You'll see this video here how we're bringing the stick up overhead, keeping our back flat here and stretching into that full shoulder flexion. Big key with a lot of these shoulder mobility exercises is we do not want to push through pain. We want to go to where our body is going to allow us to go without causing excessive irritation to the tissue that's already irritated. Another shoulder mobility exercise that we really like to use a lot are going to be our floor angels. This is going to help kind of open up the chest a little bit more. We talked before about these postural issues that we run into. So this is just trying to reverse some of that rounded shoulder position that we get in a lot when we're on our phone or on laptops throughout the day. Again, we want to be through a pain-free range of motion. We want to keep that low back flat on the floor so that we're making sure that we're moving through the shoulder and not the spine. You'll see Brian tuck his ribs and then reach up overhead, sliding along the floor here. We're going to follow these up with a couple of our shoulder stability exercises. As Dr. Blue mentioned, that sometimes we'll have some shoulder stability issues with instability or dislocation. The first exercise we're going to show here is a farmer's carry. In this exercise, we're going to be holding weights or kettlebells at our side and walking. The key with this here is not to have the weight rock back and forth and try to stay standing as tall as possible. It's going to require a lot of work from both the rotator cuff and the scapular stabilizer to keep us in a good position here. It's also an exercise that has minimal rotation, so for shoulders that are a little bit cranky, they typically respond to this very well. You'll see the video here, carrying the weights at the side, standing up tall. Our next shoulder stability exercise we're going to go through are what are called shoulder taps here. So this is deemed a closed chain position, meaning that the hands are on the ground rather than holding weights. We're going to be working on being strong in that arm and not letting the body tilt at all as we're moving. And we like to perform these by tapping one shoulder and then the other here. And again, the key is not to let the body move around very much. Imagine you have a glass of water being balanced on your back here.
Great, thanks, Dan. We spoke about the rotator cuff, motion and stability problems. Let's talk about some of the joint and other problems that you can have. You may have other problems with your shoulder as well. And to complicate things, these may occur with other conditions as well. Some of these include labral tears. The labrum deepens the socket like we spoke about before and gives stability to the joint. Tears can cause the shoulder to not move or articulate properly and put undue strain on the rotator cuff. So if you try to throw a football like 40 yards and your shoulder's hanging the next day, you may have a labral tear. Osteoarthritis usually occurs in those over 50 and those younger with a history of an injury to the joint. The joint degrades slowly and can lead to shoulder replacement over time. A couple other things here. The acromioclavicular joint, also known as the AC joint, can have sprains, and confusingly, sometimes if you have a full sprain or dislocation of this, they call it a shoulder dislocation. These are common with tackling sports such as football, but also crashing on a bike. Osteolysis is wear and tear of the AC joint that can occur in weightlifters. Fractures most commonly occur in the clavicle. Again, tackling sports, bike accidents are common causes. And growth plate injuries. These are overuse injuries in kids. Think of Little League shoulder in a young pitcher who throws too many pitches with incorrect form. Finally, don't forget about referred pain from the neck and the thoracic outlet areas. These should always be considered in the back of your mind and are causes of shoulder pain not coming from the shoulder itself. Go back. So what is in our treatment toolbox? As you can see, there's a lot of different conditions of the shoulder. What can we do about these? Well, you can try resting, which is important initially, but with a couple of caveats. First of all, do not immobilize your shoulder in a sling for more than 10 days after an injury, or stiffness can set in and become a much bigger problem. Rotator cuff injuries generally will not get better if you rest them more than a week or two. Typically, an injured rotator cuff that is not rehabilitated will get weaker and turn into a chronic tendinopathy. So be smart with your rest. Ice, interestingly, given that shoulder problems are usually deep, ice is not that effective, as you would need 8 to 12 hours to freeze your entire shoulder to get to the part that would actually benefit from it. Home exercises and physical therapy, Dan will touch on these. And we can do injections for inflammation. These can help start some healing. Typically, if you get a steroid injection, it may take a couple of weeks to really see the results. These are best combined with physical therapy. Just keep in mind, multiple steroid shots over the course of your life can over time weaken your tissue and lead to tears. Finally, surgery is usually reserved for full rotator cuff tears, high-grade partial rotator cuff tears, some fractures, and end-stage arthritis when you get a shoulder replacement. How do you prevent shoulder problems? Correct training errors. It cannot be emphasized enough that proper form, especially with the shoulder, is of utmost importance. If you're trying to hurt yourself, then by all means throw, hit, or lift the wrong way over and over again. You can almost guarantee a shoulder injury will result. Use proper equipment. If you're a tennis player, get fitted to the correct racket with the right size grip and string tension. Don't do too much too fast. Plan an effective training regimen. Pitchers report to spring training early in baseball to slowly get their arms in shape. Listen to your body. Pain, weakness, and change in performance are all telling you something. Stop and get yourself evaluated. Do some baseline maintenance exercises 3 times a week for your shoulders. An ounce of prevention is better than a pound of cure.
I'm going to speak briefly on common training errors regarding exercises that we often see in the gym. As Dr. Blue said, it's going to be very important to have proper mechanics when we're doing certain lifting movements. So we're just going to kind of touch on what we sometimes see as mistakes and how we can correct them. The first one that we're going to look at here is going to be a seated row. Now you'll see as I start here, I'm going to be really rounded with my back and have my shoulders forward, and my elbows are going to be coming back past my body. That's going to be what we're going to want to avoid here. So you see in this position where we're rounded down, head down, shoulders are extended, elbows are coming way back. So what I'm going to do here is fix this up a little bit. I'm going to stand up tall. I'm going to really drive my shoulders down and back here, and really use those muscles between our shoulder blade and our spine to pull back there. That's going to be a lot more friendly for the shoulder and give the shoulder itself a lot more support to be able to do other activities. The next exercise we're going to look at right now is going to be a lat pull down. Once we skip through this here. Again, with a lat pull down, we'll sometimes see people making the mistake of having a rounded back and the elbows coming back far behind the body, as you'll see at the start right here. You see how the forearm becomes almost parallel with the ground. We're going to want to try to avoid that. We want to keep the forearm vertical in orientation compared to the ground here. So we're going to reset here and keep that chest up, not let the back round, and drive that bar straight down towards the chest there. Really engaging those muscles that are going to be sitting between the arm and the shoulder blade here, which are our lat muscles. Next, we're going to look at a little bench. Oh. We're going to look at some bench press here. Now, a major issue that I often see with bench pressing is having the elbows out too wide. That's going to put a little bit of excessive strain on the anterior part of the shoulder. And you're going to see that in the first few reps here, where there's about a 90-degree angle between the body and the humerus, or the upper arm. So that's going to be really uncomfortable on the front of the shoulder here. What we're going to want to see is more of a 45-degree angle between the body and the upper arm. That's what we're going to see on this reset here, where the elbows are kind of tucking in a little bit more. Going to be a lot more shoulder friendly there. And it's going to allow the pecs to work a little bit more, which are our main movers when we're looking at a pressing motion like this. Another alternative to the bench press, I know bench press can a lot of times be everyone's favorite exercise, If we can switch that to a dumbbell bench press and have some rotation with the hands as we're lowering back down, it's going to allow the shoulder to be able to get into that packed position a lot more comfortably and have a lot less stress on the front of the shoulder. You're going to see that in this exercise here. As we rotate with the palms facing each other, we're at the bottom of the press, and then we can rotate with the edge of the weight facing each other at the top of the press there. This is a really good alternative for anyone that's having anterior or front-sided shoulder pain with bench pressing. It's also a very good option for people that are trying to get back from a shoulder injury and don't feel quite comfortable getting under a bar yet. You can start with low weight and just get more comfortable with this pressing motion. And then lastly, we're going to see a shoulder press here. The big issue that we see with shoulder pressing is people getting into a really arched position on the low back and not really getting vertical with the weights. A caveat with this is a lot of times when we talk about people that have spent a lot of time sitting at a computer or on their phone, they'll have that rounded posture. That makes it really difficult for them just to do a pure shoulder press overhead. So we're going to start with seeing that kind of big rounded arched back here. We're not really getting up overhead. We're kind of going at an angle. Then we're going to get a reset here. We're going to try to flatten out that low back and get a little bit more directly up towards the ceiling. If you're going to be attempting these shoulder presses here, you're going to want to make sure that you can do that shoulder flexion and floor angel exercise that we showed earlier to kind of prep you to be able to do an overhead press. And then I'm also going to touch on a few exercises that are kind of key shoulder maintenance exercises. These can definitely be substituted at home, but they can also be effective if you're performing them in the gym as well. And the four main ones that I really like are the prone swimmer, bent over row, a face pull, and landmine press here. So prone swimmer is going to be more mobility based here. And we're going to be working on lying on our stomach, retracting the shoulder blades, and being able to move in a range that's called abduction up to 90 degrees and then up to about 150 degrees here. So this is going to be working all of those scapular stabilizer muscles. This will be really good for shoulder health, for opening up the front of the chest there and making sure that we can rotate through the joint. Next is going to be the bent over row. Rowing should really be the number one kind of keystone exercise for any kind of shoulder health program. So in this picture here, I'm using a weight and I'm making sure again that the elbow is not coming up too high. The real focus is on moving this weight here with my shoulder blade and not moving too much through the arm here. We want to feel a big pinch with the shoulder blade coming down and back towards the spine. Next is going to be a face pull. So this would be somewhat similar to that rotator cuff exercise that we looked at earlier. It's going to be a little bit more challenging because we're now getting away from the body up into an abducted position with the arms here. This is going to work a lot on the scapular stabilizers, but it's also going to work on that posterior rotator cuff here. And again, like I keep repeating myself, a lot of these exercises are reversing those daily postural positions that we're in when we're sitting at our desk here. So really effective kind of opening up the shoulder there and making sure the posterior aspect of the shoulder, the back of the rotator cuff is functioning at a high capacity there. And lastly, there we are. Lastly, we're going to look at a landmine press here. So this is going to be something that's a little bit more specific for if you're in the gym or if you have a barbell at home. Now this exercise here is my favorite pressing exercise for the shoulder because it gets the scapula to rotate upwardsly. Again, kind of reversing a lot of the positions that we're in day-to-day life. And can be a little bit more shoulder friendly than the normal bench press or shoulder press.
Excellent. Thanks, Dan. Finally, I figured I would end here with a picture of myself. The shoulder is a complex joint. Like I said in the beginning, you really do not appreciate the shoulder until somebody takes it away. for those of you who have had shoulder problems, you know exactly what I'm talking about. If your shoulder's been bugging you, my advice to you is this. First, get your shoulder problem diagnosed. You don't necessarily have to make an exact diagnosis, but you should have a good idea of what problem you have. Is it a rotator cuff problem? Is it a problem with motion or loss of motion? Is it a stability or instability problem? And finally, is it a joint problem? Try getting yourself better with the ideas Dan discussed with you here today, but if you are not getting better, seek the professional advice that you need. We are here to help. And at this point, Lee, I think we'll open up for discussion or questions.
Thank you, Dr. Blue, and thank you, Dan, for an amazing presentation. We are now open for Q&A session. Please direct your questions through chat or Q&A buttons on the bottom of your screen. And I do have a couple of questions to start with. Can you explain impingement? Would that be a popping or less than smooth movement? Any exercises to help?
So impingement is typically when you pinch the soft tissue of your shoulder between the arm bone and the acromion, which is part of the scapular shoulder blade. When we do things such as swimming or tennis or throwing a ball, we can chronically pinch this tissue. Everybody has different types of anatomy, but for the most part, I don't think as human beings we're meant to throw a ball 150 times in a game every fifth day. I don't think we're meant to swim mile after mile. And a lot of these sports, it becomes survival of the fittest. Impingement requires that you really have perfect form with your shoulder and that you listen to your shoulder and make sure you're paying attention to your symptoms so you don't end up with a bad injury such as a rotator cuff tear. But in terms of exercises, I'll leave it open to Dan for impingement.
Sure, yeah, my two favorite exercises for impingement are going to be that rotator cuff exercise that we looked at first, where we have our arms tucked at our side and rotating the band out, and also our bent over row. Big issue that we see with impingement is a fatiguing or kind of weakening of the scapular stabilizer muscles. So we end up kind of getting our shoulder in a tough position. So if we can really focus on getting strong through the back of the shoulder, typically those can help clear up that impingement. At least early on. And then what we want to do following that is our range of motion stuff, making sure that we can restore that full shoulder flexion after the impingement symptoms have started to calm down a little bit.
Thank you, Dan. And Dr. Blue, the next question is, I'm a musician and I'm aware of my exercises and posture to allow me to hold my instruments up for long rehearsals and performances. However, when I sleep, I tend to shrug my shoulders at night and wake up achy and often stiff. I've tried different pillows and positions. Is there any other option to prevent this?
That's a tough one. Yeah, it's tough. It's gonna be tough to really control what you're doing when you're sleeping because your body's going to go where it feels comfortable. It's a good idea that you've already tried different pillows. Definitely, I try to recommend that we have just one pillow for the most part, so that we're not kind of pushing the shoulder of the head forward. If it's something where you keep lying on a shoulder and it gets that stiff and kind of achy there, you can kind of build a little pillow wall to try to prevent you from rolling over onto that side. But making sure before and after, in the evening, and then when you wake up, try to get the shoulder moving a little bit. Try to stretch it out, get it rolling there, and typically that can kind of take away some of that stiffness or achiness that we might be feeling in the morning.
Yeah, I think what Dan said earlier. We sit in a certain position most of the day, whether you're a musician or you sit at a desk, and in most of these positions, we're sort of stretching our back muscles and we're contracting our front muscles of our chest and shoulder. And if you can do just the opposite, work on the strengthening of the back and work on the flexibility of the chest, it tends to balance you out. If you're a musician, you're sitting in that position most of the day, I think these exercises are even more important for you.
Thank you. The next question. Could shoulder problems arise from weak core? What type of core exercises could help?
Sorry, I just want to make sure I understand the question. So could they result from what?
Could shoulder problems arise from weak core? And what type of core exercises could help?
Yeah, so kind of as we're pretty familiar with. Everything's kind of connected through the body there. Especially when we're thinking about an athlete, an overhead athlete, if we have some weak abdominal muscles or weak core muscles, we end up having a little bit of a leak of power from the lower body through the trunk up to the upper body, which a lot of times we see with baseball players having some shoulder issues there. So that can definitely have an effect depending on kind of what your activities are and what your intensity of those activities are. My favorite kind of go-to exercise for the core is going to be a plank. I actually like modified planks on our forearms and knees, and just really focusing on really tucking the pelvis. But there are a lot of different core exercises that you can work on. I think the biggest emphasis that I have with a lot of my core exercises is making sure that we feel like those lower abdominal muscles are engaged. We do that by tucking the pelvis there. If we can do that, you're typically going to be pretty good with most of your core exercises.
Thank you, Dan. The next question. If an injury occurred 20 years ago and the mobility of the shoulder was lost, is there anything that can be done to regain that mobility, or even a surgery could fix that?
So it kind of depends if there's a bony block or maybe your anatomy is off. Those may be surgical problems. And I think that's best addressed by looking at an x-ray or an MRI. But soft tissue stiffness or tightness can be worked on. It is super difficult with the shoulder to regain that. And you have to be very patient. It can take a long time. A lot of times when patients have impingement, it can take 3, 6, 9, 12 months or even longer to regain motion. And there may be something blocking it. Maybe you have a calcium piece in your shoulder, or maybe you have arthritis. But I think it's best, A, to get it looked at to make sure you have the anatomy to get it better. And then B, just be really patient with some of the exercises what Dan gave. It takes a long time to get the mobility back in your shoulder.
Thank you, Dr. Blue. The next question. Do you recommend TheraBand RTC exercises for baseball pitchers, players?
I think they can be very effective, especially for a warm-up. But when I think about a baseball pitcher, it's really a full body exercise. So the rotator cuff TheraBand work can be excellent, but we want to make sure that we are strong throughout our lower body and our core. So making sure that the baseball player is an athlete first and can move like an athlete, and use those rotator cuff TheraBand exercises as a kind of adjunct or something to kind of load on top of that baseline strength and conditioning that they're going to need through the rest of their body.
Yeah, Leah, one more thing. I think if you're a baseball player, I think the best time to exercise your shoulder muscles and rotator cuff bands is after a practice or after a game. It's probably the least likely time that you want to do it when you want to hang out with your friends, but it's probably the most effective. You don't want to fatigue your muscles before you start throwing or playing, but afterwards is a great time to do it.
Great, thank you, Dr. Blue. The next question. Does impingement mainly create sharp pain in the muscles in the upper arm?
Impingement will probably be loss of motion. You can also get pain on the upper outer part of your upper arm, but impingement is mostly a problem bringing your arm up to the side and cocking your arm back. And you can't get the strength or velocity that you need because you can't get your arm back into the proper cocking position.
Thank you. The next question. What is the cause for shoulder pain radiating to the arm and hands?
Anytime you have rotator cuff pain, you can get radiation of the pain down your upper arm. But once it goes past your elbow or into your wrist or hand, I think you need to think about your neck as a culprit. It also could be a nerve that leaves from out of your neck through the thoracic outlet. You can get impingement there, and there's different types of thoracic outlet syndrome. But if it's really in your hand, wrist, forearm, I think you need to think higher up, and it may not be in the shoulder.
Thank you, Dr. Blue. Next question. Should I push through pain with my shoulder exercises?
No. We definitely don't want to push through pain with the shoulder exercise. It can be a little tricky sometimes, kind of understanding, all right, what's muscle burn versus what's acute pain. But if any of your exercises are recreating or exacerbating the symptoms that you're already being seen for, they're already trying to improve, that's going to take some more assessment, kind of changing those exercises because we don't want to increase that exacerbation.
Lee, I think this is a really good point for Dan, and this is why people see physical therapists, because you do need to push it a little bit, but you can't. I think you need to listen to pain, and everybody has different pain thresholds, so it's difficult to say where you should stop. But obviously, try it on your own. If you feel like you need help, I think that's where a physical therapist can really kind of push you a little bit and see what your limitations are. But I think pain. I agree with Dan. Pain is not good. You should feel uncomfortable, but it really shouldn't be painful.
Thank you, Dr. Blue. The next question, how can I get better at reaching behind my back?
Yeah, so that's going to, a lot of times, there can be a few different factors that's going to play into that, but a lot of times it'll be tightness in the back of the shoulder. So we have a couple different things we like to do. We like to do some soft tissue work that you can actually do on your own, just kind of putting a baseball or a crossball on a wall and rolling on the back of the shoulder there in that rotator cuff area. You're probably going to find some spots back there that are pretty tender and tight. We can get those spots to kind of relax a little bit. Typically that's going to improve your motion there. And also you can look at a stretch called a sleeper stretch. And those sleeper stretches are going to help what's called shoulder internal rotation. And that can help restore that motion reaching behind your back.
Thanks, Dan. The next question. You mentioned that shoulder pain can be referred pain from something like a disc injury. How can we tell where the injury is coming from? For example, I've been having pain in the left shoulder blade, but just recently had an x-ray and was told I have a disc problem in my neck that is likely causing the pain plus tingling, itching in the forearms. How do you determine the source when it is so nebulous?
So that's a great question. It's not always evident. A lot of times things can look like something, but to really kind of prove it, you probably would need to get nerve conduction studies just to sort of prove that it's coming from a nerve. But typical things happen commonly in medicine. And so if you have a problem with a joint or a disc in the neck and you have certain patterns of referred pain, and your exam kind of matches up with that, a lot of times we can make the diagnosis without ordering the nerve conduction studies. MRIs, x-rays of the neck can be helpful. And a lot of times your response to physical therapy, some of the exercises for your neck would be telltale. If you get better, obviously, with certain neck exercises and your shoulder blade pain and arm pain get better, it's probably coming from your neck.
Thank you, Dr. Blue. Next question. Could rotator cuff injuries cause knots in shoulder blades and upper arms?
I'll take that. I think knots or nodules or muscle bundles or trigger points around the scapula usually occur from muscle dysfunction there or from your neck. I think the rotator cuff typically gives you things in the upper outer arm and not so much around the shoulder blade. I think rotator cuff problems can give you problems with the shoulder blade and result in that, but it's not typically coming right from the rotator cuff.
Thank you, Dr. Blue. And the last question for today. If I do need to get surgery for a torn rotator cuff, how long until I am back to normal?
I guess it depends on if it's a full tear or partial tear, but it also depends on what you do. If you're a high level tennis player or baseball player, it's probably going to be a year out of your career. It's pretty hard to come back from that and actually have the same performance throwing a ball the same speed. But typically full rotator cuff tears are a 6 to 12 month window. And I would probably leave the rest to Dan because he sees a lot of those.
Yeah. I think the number one thing that I can talk about as far as that is just preaching patience. Rotator cuff rehab can be arduous, can be tedious at times. So it is significant, like Dr. Blue said. 6 months for kind of like the normal kind of doing normal things around the house, being able to do housework. And if we're thinking about an overhead athlete like a tennis player, baseball player, quarterback, then you're looking at a year plus there. So definitely significant rehab that you need to really commit to and have patience with throughout that course.
Thank you both. I actually have one more question. Can people do their ADLs with RTC tear?
Yeah. I mean, and it's going to be really dependent. Everyone's going to be a little different depending, like Dr. Blue said, on partial tear versus full tear. And some people are able to really kind of compensate for those tears and can get away with being able to do ADLs without too many big issues. Some people, the pain or the lack of strength or range of motion can be pretty debilitating. So potentially, yes, people can do their ADLs with the rotator cuff tear, but it's going to be really case specific as to the person, their demands, and the type of tear that they have.
Thank
Yeah,
you.
I think if you want to stay home, and watch Netflix, you should be fine. But if you want to lift up things around the house, it's going to be pretty difficult. I agree with that.
Thank you, Dr. Blue. And thank you everyone for joining us today. We hope you enjoyed the webinar. Just a reminder that recording will be available on our website under news, past events. Couple of you asked for the links for the exercises Dan presented. Again, it'll be included in recording. If you have any additional questions, you can always email us at info@orthonorcal.com or call the office directly at 408-412-8100. Enjoy the rest of your day. Thank you and bye-bye.